The second chemical class is Arylakanoic acid. Their action this time is by reversible inhibition of COX-1 and COX-2. They have many derivatives and their degree of selectivity is also different. Arylakanoic acid. Please look to the chemical structure. We have an aliphatic acid attached to an aryl function on the alpha carbon. This alpha carbon might be hydrogenated, unsubstituted, or substituted with a methyl or alkyl function. The acidic center is resembling the carboxylate of arachidonic acid, and hence it is able to occupy the same active pocket as arachidonic acid, causing the inhibition of COX-1 and COX-2. Looking to this carbon, please. This carbon is a center of asymmetry when it is substituted. It is separating the anion from the aromatic or heteroaromatic group that fits the flat area on the receptor. If this carbon is substituted with a methyl function, this case will be a propionic acid derivative, and the anti-inflammatory effect will be greater due to the higher lipophilicity. We can find another non-coplanar area that is able to fit the out of the plane trough, as we have seen in indomethacin. We can classify or subclassify the arylakanoic acid as aryl heteroacetic acid, aryl or heteroarylacetic acid, and the other subclass is aryl and heteroarylpropionic acid. This is according to whether this alpha carbon is substituted with a methyl or not. Starting with the heteroarylacetic acid, indomethacin is the prototype of this group. It possesses an indole function. This indole function is planar. It occupies the flat area on the receptor. The ionic group, the anionic carboxylate, is suiting complementary a cationic site on the receptor. The para-chlorobenzoyl function is hosted by the out of the plane trough, which is achieving a high degree of fitting to COX-1 and COX-2 receptor active pocket. It was observed that the direction of the para-chlorobenzoyl group on the nitrogen of the indole nucleus should be in a cis direction with the methoxy group allocated on the phenyl ring. Diclofenac is another structural derivative of aryl acetic acid derivatives, and as we can see, we can find diclofenac as sodium or potassium salts. Please have a look on the nitrogen at the position number 2 of the structure. It is substituted with a dichlorophenyl. The chloro functions are allocated on the ortho position of the phenyl ring, keeping a restricted rotation of the flat aromatic ring. So having these two chloro substituents on the ortho position in diclofenac is restricting the rotation around the single bond with the nitrogen, keeping the out of the plane trough that is needed to fit the COX receptor active site. Diclofenac is not only inhibiting COX, it has an activity by inhibiting lipoxygenase pathway and inhibiting even the arachidonic acid release from the phospholipid membrane. Coming back to the concept of the restricted rotation produced by the 2-ortho-chloro group, as I told you in the few seconds that the 2-chloro functions are limiting the twisting of this second area of planarity. Pharmacokinetically, the potassium salt was found faster acting than the sodium salt of diclofenac. Etodolac is another example of indole 1 acetic acid derivatives. How? It includes, in addition to the indole acetic acid, a pyrano substituent, a pyrano ring fusion that is allocated between the indole and acetic acid residue. This class of drugs is known as pyranocarboxylates. Please keep in mind that there are 2 carbon separation between the carboxylic acid function and the heteroaromatic ring. So this structure is having optical isomerism, where only its S-positive enantiomer is active as an anti-inflammatory drug. Etodolac was marketed in the market once released as a selective drug having less incidence of gastrointestinal side effect. The structure-activity relationship of the pyran carboxylate is discussing the length of the acid chain, or even the ester or amide. They are all inactive when we increase the length of the acid chain or we convert it to the ester or amide. At the same time, the alpha methyl acetic acid derivative are inactive, so they should be ethyl or alpha ethyl rather than alpha methyl acetic acid derivatives. They found that the ethyl or the N-propyl derivatives were, we are talking now about the R2 function, were more potent than the methyl ones. The 8th position is the position that should be substituted for the most beneficial outcome. We can find 8 ethyl, 8 N-propyl, 7 fluoro, 8 methyl derivatives in the market. Please have a look to this nabumetone. Nabumetone is a non-acidic structure, rather, and it appears in its name, it is a ketonic structure having naphthalene core as the flat area, and this naphthalene is attached to a methoxy function and a butanone function. It is non-acidic, as we said. It is a prodrug, as it is not fitting as such the receptor, the COX receptor. It needs to be activated through metabolic pathway to produce the 6-MNA metabolite. This 6-MNE is an abbreviation for the 6-methoxy-2-naphthyl acetic acid. So this butanone function will be converted biologically after metabolic pathway to the acetic acid derivative. It inhibits the prostaglandin synthesis, occurring mainly in joints, so it is claimed and marketed as a drug having no gastric or mucosal irritation. Introducing an alpha methyl group on the acetic acid moiety produces the second class of heteroarylpropionic acid, where the alpha carbon just neighboring the carboxylate function is substituted. The prototype of this class is ibuprofen, and following the name, it is an isobutyl derivative of phenyl propionic acid derivatives. Of course, the introduction of this methyl function on the alpha carbon produces a center of chirality where we can find two enantiomers, the S positive and the R negative isomer, where the S positive is the active one. Ibuprofen is marketed as a racemic mixture because biologically the R negative enantiomer, the inactive isomer, is inverted to the S positive enantiomer, which is the active one inside our bodies. Ketoprofen is another example of Nsaids related to phenyl propionic acid class. According to the name, it produces a keto function. We can see it here between the two phenyl groups. It has not only the effect of inhibition of prostaglandin biosynthesis, it has a direct effect on the synthesis of leukotrienes and leukocytes, and it has also an anti-bradykinin activity. The third class of chemical classification is the N-aryl-anthranylic acid. They are also called phenamic acid, and if we analyze the structure, we are going to find that they are nitrogen isosteric derivatives to salicylic acid. They have also their ability to inhibit prostaglandin biosynthesis, and they fit the proposed active pocket of cyclooxygenase enzyme. Please have a look on the meclofenamate. Keep your eye on the nitrogen. The nitrogen here is the isosteric substitution of the oxygen that was present in salicylates. The structure is named anthranyllate because of the presence of the nitrogen at the 2 position to the carboxylate. This is meclofenamate sodium. It is an anthranyllate derivative. We can find that the 2 chloro functions, as in case of diclofenac, are still playing the same role to prevent the twisting, keeping non-coplanar structure of anthranyllate, so they enhance a good fitting at the active site of COX enzyme. Switching the NH to other substituents like oxygen, CH2, sulfur, SO2, etc. reduces the activity. Please pay attention that if the carboxylate is away from the N, it is no more anthranyllate and the activity will be lost. The metabolism of meclofenamate is including oxidation of the methyl function to be converted to the hydroxymethyl, which is the primary alcohol form, and then to the acid form. Another oxidation reaction is constituting the hydroxylation of the aromatic ring, even the mono dehalogenation and conjugation. Up to the hydroxymethyl derivative, the first active metabolite, it is still active as such, while it is converted to an inactive one upon further oxidation to the carboxylate. The precedent classes of Nsaids were possessing typically a carboxylate anion, and they were able to fit through their carboxylate anion the cationic site of COX enzyme. The pyrazolidine dione class of non-steroidal anti-inflammatory drugs, they are able to inhibit the prostaglandin biosynthesis in a way similar to the carboxylate derivatives, while they do not possess carboxylic acid residue. Their acidity is related to their structure. Let's remember what is the definition of an acid. An acid is a compound that is able to lose a proton, leaving a stable anion. This class of pyrazolopyridine diones, as we can see in phenylbutazone and oxyphenbutazone, they do not contain a negative carboxylate anion. Rather, they are possessing a hydrogen that is easily removed and forming a stable anion, and this stable anion is stabilized by resonance. That's why a negative charge will be created on the structure and will be able to fit the cationic site on the receptor, but there is no carboxylic function or a carboxylic resonance a carboxylic group at the structure as a true carboxylate. As I explained now, the removal of this proton will form a stable anion that is stabilized by resonance, where the negative charge will be oscillating between the two oxygens surrounding the negative charge on the pyrazolidine structure. R1 and R2 are two aromatic functions that enhance the stabilization by resonance and enhance the stability of the formed anion. This way, the pKa of this structure is typically acidic due to the presence of these two aryl functions. The pyrrolo or oxazolo derivatives, they retain anti-inflammatory properties as the pyrazoles. The fifth chemical class is the oxycams. Oxycams are again derivatives that are lacking the presence of a carboxylate as an anion function, but they are considered as enolic acids of the hydroxybenzothiazine carboxamide class. The acidity is obtained upon the release of the hydrogen of the hydroxyl function and leaving a stable anion that is delocalized. The negative charge is delocalized on the oxygen function. According to the R function, not the R1, the R function, if this R function again is an aromatic function, the negative burden will be distributed again on the aromatic ring, that will enhance the acidity of the structure. R1 is a methyl function, and as I said before, the R is important to be an aryl or heteroaryl function to uh, um, to, to, to extrapolate the resonating effect of the negative charge on the oxygen, and it's better to have the carboxamide derivative as primary carboxamide rather than secondary, because the hydrogen is essential in extrapolating the resonating structure of the enolate anion. Let's see the pyroxycam, which is the prototype of this class, and let's examine how the anion produced is sufficiently stable that the acidity of this compound, their pKa, is reaching 6.3. So they are considered as enolic acids, and they are stabilized from the point of view an anion formation, so that they are able to fit on the active site of the receptor. Another character for pyroxycam is its remarked extended plasma half-life, where a single daily dosing is possible. The sixth group, the sixth chemical class, is those selective cyclooxygenase 2 inhibitors. The selective COX-2 inhibitors, they eliminate the side effect of being associated with gastric irritation and ulcers, as the traditional inhibitors of COX-1 enzyme are doing. There is no risk for gastric erosion, ulcers, bleeding, minimal risk of renal effects and bleeding tendencies. And as I described before, the isoleucine residue, that is a bigger amino acid than valine in COX-1, it restricts the access of these large selective inhibitors having almost a spherical bulky structure in space, so they are not able to reach the active pocket of COX-1. Rather, they are able to reach the active site of COX-2 due to the presence of the smaller valine residue at COX-2. Celecoxib, as we can analyze its structure, it is composed of 3 rings. They have free rotation around single bond. A bulky spherical structure can be achieved due to the bulky effect of the sulfonamido function, as well as the rings that are able all to rotate around single bonds. Rofecoxib is the second structure that is having a methyl sulfone function instead of an amino sulfonyl group. And the hetero ring that is present is not a pyrazole as in case of celecoxib, rather it is a furanone as we can see in rofecoxib. Rofecoxib pharmacokinetically is offering better pharmacokinetic properties and duration, bioavailability than celecoxib. For those patients that are treated long time with selective COX-2, example those suffering from cancer, in their terminal stages. They are administering for a long time the COX-2 inhibitors, and they are facing some problems like acute myocardial infarction or ischemic cerebral or vascular strokes. This is because these these compounds are, yes, safe from the gastrointestinal point of view, but they have a great thromboembolic risk involving the coronary or even the cerebral vascularity. So the COX-2, yes, they are selective as the point of view gastrointestinal, but they are still their own risk regarding the thromboembolic events. Disease modifying anti-rheumatic drugs is the third class of therapeutic classification. The MARDs are drugs that are beneficial not in symptomatic treatment of arthritic disorders, but they are stopping the progression of arthritis, while they are lacking the anti-inflammatory or the analgesic effects of traditional non-steroidal anti-inflammatory drugs. The MARDs are usually used to stop the progression of arthritis, and non-steroidal anti-inflammatory might be concomitantly administered in order to alleviate pain, but they are ineffective in stop or preventing the pathogenicity of arthritic disorders. Chemically, we can classify them into gold compounds or aminoquinolines. Another naturally acting derivatives are the immunosuppressive agents, and we are going to cover these three categories. Gold compounds. The gold compounds, they have their ability to inhibit lysosomal enzymes, so they can prevent the inflammatory response. These gold compounds being or having a gold residue, they are able to interact with the SH groups on enzymes, so that their side effects are including many symptoms: dermatitis, mouth lesions, pulmonary disorders, nephritis, and hematological disorders. Those patients that are suffering from great side effects of such compounds, they can be treated with chelating agents such as penicillamine or dimercaprol in order to to limit the side effect of the gold compounds. The first structure in the gold compound is the sodium thiomalate, the gold sodium thiomalate. We can notice that the gold is approximately occupying 50% of the whole weight of the structure. It is administered intramuscular due to its polar nature. On the other hand, oranophine is a second candidate where gold is approximately 29% of the structure. Its lipophilicity, due to the presence of many acetyl function, its lipophilicity is a factor that permits its oral bioavailability. It has fewer adverse effects than the parental type, and they promote continuity in their administration. Aminoquinolines as they are accumulating in lysozymes, they can inhibit the effect of certain lysosomal enzymes, and hence they can stop the progression uh, of tissue damaging. Chloroquine, hydroxychloroquine sulfate are two examples of this category of drugs. Regarding the immunosuppressive agents, they are derivatives able to interfere with some steps that are involved in pathogenesis of rheumatic disorders. So they can inhibit the overexpression of interleukins or tumor necrosis factor alpha. In this way, they can stop the development or progression of arthritis. These immunosuppressive agents are developed or were developed in two different approaches. One is to administer a TNF receptor, which is the etan receptor. This is the first drug. It represents the tumor necrosis factor receptor in a soluble form. The other is by developing an anti-tumor necrosis factor antibodies, as with infliximab. Etanercept was the first biotechnology-derived drug to be used for treatment of rheumatoid arthritis. It is produced by the recombinant DNA technology. It is a dimeric structure, يعني possessing two similar parts, so it is a receptor that is able to bind to two tumor necrosis factor molecules. It is either used alone or in combination with methotrexate. The infliximab, on the other hand, is a monoclonal antibody to the tumor necrosis factor alpha, and again it is usually used in combination with methotrexate to stop the progression of arthritis. After finishing the DMARDs, we are going to deal with drugs used to treat gout. Defining gout is it is a state where there is an elevation in levels of uric acid in plasma and in urine. It can be either acute or chronic disease, where we have to control the gout by different strategies. First of all, to reduce the inflammation due to the deposition of urate or uric acid crystals, increasing the uric acid excretion, or inhibiting the biosynthesis of uric acid by inhibiting xanthine oxidase. So we have more than one strategic plan to treat gout. The first, again I'm repeating, is interfering with the inflammation, just simply to reduce the inflammation caused by the deposition of uric acid crystals. The second is by using uric acid eliminating drugs or enhancing its excretion. The third is by inhibiting xanthine oxidase and hence preventing the synthesis of uric acid. So drugs used to treat gout, they can be classified this way, either as drugs used to treat acute attacks and those treating chronic gout. Colchicine and Nsaids are kept to treat acute attacks of gout, while uricosuric agents, those that increase the solubility and excretion of uric acid, xanthine and xanthine oxidase inhibitors, are reserved for chronic gout cases. Colchicine has a unique mechanism of action is by inhibition of the production of lactic acid. This way, the lactic acid non-produced will precipitate in an increase in the pH of the synovial tissue and hence uric acid solubility. It also inhibits the release of lysosomal enzymes and contribute to stopping the progression of inflammation. And of course, non-steroidal anti-inflammatory drugs, even including those acting against COX-2, selectively are used as drugs treating acute cases of gout. Please keep into consideration that aspirin is contraindicated in this case because there is a mechanism inside our body that is called organic acid secretion mechanism. Aspirin and uric acid will compete on this mechanism. So please, aspirin is contraindicated because it will interfere with the excretion of uric acid. Probenecid is one of the drugs used as uricosuric agents. Uricosuric means enhancing the excretion of uric acid by decreasing its reabsorption. Probenecid as a sulfonamide derivative, it is a sulfonamido compound possessing a carboxylate group at the para position of the sulfone function. It is one of the candidates related to this class. Sulfenpyrazone, that is similar in structure to pyrazolidine diones that we discussed in the non-steroidal anti-inflammatory class. Coming to drugs preventing the deposition or the synthesis, not deposition, I'm sorry for this, for the synthesis of uric acid. How is exactly uric acid formed inside our bodies? As we all know that nucleic acids are composed of different nucleic bases, either pyrimidine or purine. The purine metabolism, starting from adenine and guanine, by the influence of adenine deaminase or guanine deaminase, will lead to the formation of hypoxanthine and xanthine. So the first step is a deamination of either adenine or guanine, producing hypoxanthine or xanthine. Hypoxanthine or xanthine are still purine analogues possessing more than one OH function. Xanthine is possessing two OH functions, and it was produced either by guanine deaminase or by xanthine oxidase by its activity on hypoxanthine. A third OH will be substituting the remaining hydrogen is by the activity of xanthine oxidase. For the second time, this will synthesize uric acid. Uric acid is easily after this converted into more soluble derivatives by the activity of uricase. So uric acid has in its biosynthetic pathway one of the very important enzymes, which is xanthine oxidase, that is capable to introduce OH functions on the hypoxanthine, producing the xanthine and the uric acid. Inhibiting this xanthine oxidase enzyme will certainly reduce the biosynthesis of uric acid. Allopurinol is a drug that is similar in structure to hypoxanthine, but it has, instead of an imidazopyrimidine structure, it has a pyrazolopyrimidine structure. It is related in structure to hypoxanthine, as we can see, and to xanthine on the other hand. That's why it is able to fit to the active site of xanthine oxidase through a reversible interaction, it has better or greater affinity than hypoxanthine or even xanthine, and this way the xanthine oxidase is inhibited and uric acid synthesis will be reduced. The same way, allopurinol is also hydroxylated by the activity of xanthine oxidase, and it will be converted to alloxanthine, which is also named oxypurinol. This way, uric acid level will be decreased, but there will be an accumulation of xanthine and hypoxanthine in urine. But having higher solubility than uric acid, they are readily, so they will be easily excreted. Now we come to the end of our lecture. A little exercise I want you, my dear students, to do is to find the structure of sulindac and to be able to defend its structure to activity relationship as a non-steroidal anti-inflammatory drug, and at the same time to find the structure of ketorolac, discussing its structural characteristics, and of course we can find this knowledge in one of our important reference books as the basic principles of medicinal chemistry, or Foy's principles of medicinal chemistry. Thank you so much. I wish you enjoyed the lecture, and to the next lecture inshallah.